What is the Global Malnutrition Composite Score? In this video, we'll talk about what this metric is, how it will impact your healthcare facility, and how you can start tracking it. So what is the Global Malnutrition Composite Score? First, let's back up a little. The Centers for Medicare and Medicaid Services, or CMS, requires that hospitals track and report on certain metrics related to the quality of clinical care. CMS wants to know that Medicare beneficiaries are receiving good quality medical care. Each year, CMS announces which clinical quality measures are required to be tracked and others that are optional. In 2024, CMS introduced the Global Malnutrition Composite Score as a new optional clinical quality measure. This announcement came after years of advocating by the Academy of Nutrition and Dietetics and Avalere Health. The Global Malnutrition Composite Score looks at the quality of nutrition-related care hospitals provide to patients age 65 and older who are at risk for malnutrition and are expected to stay in the hospital for more than 24 hours. The Global Malnutrition Composite Score has 4 parts. Number 1, nutrition screening. Was the patient screened for nutrition risk upon admission? Number 2, nutrition assessment. Did the patient receive a comprehensive nutrition assessment by a dietitian if needed? Number 3, malnutrition diagnosis. Was the patient appropriately diagnosed with malnutrition by a physician or mid-level provider? And number 4, the nutrition care plan. Did the patient have a documented nutrition-related care plan that detailed what nutrition interventions were ordered? Patients who meet the criteria for the Global Malnutrition Composite Score, that is, they are 65 years and older and are expected to stay in the hospital for more than 24 hours, can earn points for each of the 4 parts that are completed appropriately. What's unique about the Global Malnutrition Composite Score is that the patient's journey is customized according to their needs. Let's look at an example. Let's say we have a patient who is admitted to the hospital with a history of pancreatic cancer. She is screened for nutrition risk upon admission and is determined to have high risk for malnutrition. So the patient is referred to a dietitian for a full nutrition assessment. The nutrition assessment is completed and the dietitian documents that the patient meets criteria for a diagnosis of malnutrition. Nutrition interventions are ordered and documented in the care plan. However, the attending physician disagrees with the dietitian's determination that the patient is malnourished, so he does not issue a diagnosis of malnutrition. In this example, the patient has the opportunity to earn 4 points, 1 for screening, assessment, diagnosis, and care plan. The patient had 3 of the 4 steps completed appropriately, but she did not receive a diagnosis of malnutrition, even though it was recommended by the dietitian. So for her Global Malnutrition Composite Score, this patient receives 3 out of 4 points. Let's look at another scenario. Our second patient is an elderly gentleman who fell while playing pickleball and injured his shoulder. He is admitted to the hospital after reporting some dizziness in the ER. He is screened for nutrition risk per hospital protocol. According to the screen, he is not at risk for malnutrition. So his Global Malnutrition Composite Score journey ends here. This patient was eligible to earn 1 point, and he did so. Because the nutrition screen determined that he was not at risk for malnutrition, he didn't need an assessment, diagnosis, or care plan. How will the Global Malnutrition Composite Score impact your facility? The CMS quality measures are a requirement for all hospitals that receive Medicare and Medicaid reimbursement. They are publicly reported, and noncompliance with reporting can impact a hospital's reimbursement from CMS. The Global Malnutrition Composite Score is one of the optional metrics, meaning a hospital can choose to track it or not. Most likely, hospitals will choose to track and report on the Global Malnutrition Composite Score if they are doing well with malnutrition care. How can you start tracking the Global Malnutrition Composite Score? If you would like to advocate for your facility to choose the Global Malnutrition Composite Score as one of its CMS quality measures, step 1 is to reflect on your current malnutrition care practices. Are you doing well with all 4 steps of the Global Malnutrition Composite Score? And are there any areas that need significant improvement? Step 2 is to talk with your clinical nutrition leadership and quality improvement team. Explain the impact of malnutrition on clinical outcomes and why it would be beneficial for the patients and facility to track and report on the Global Malnutrition Composite Score. And step 3, keep improving. Continue to track metrics related to malnutrition and assess what areas need improvement. Maybe new nurses need a refresher on how to complete the nutrition screen, or you need additional weekend dietitian coverage to have nutrition assessments completed in a timely manner. Look at it as a continuous performance improvement project. If you're interested in learning more about the Global Malnutrition Composite Score, visit shop.dietitiansondemand.com and check out the webinar, Understanding the Global Malnutrition Composite Score. The link is in the video description.